Welcome. Today I'm chatting with senior fertility nurse Victoria Powell from the Agora Fertility Clinic in Brighton. Hello, how are you?
I'm fine, thank you. How are you?
Very well, thank you. Today we're going to be discussing IVF protocol tips for injections and the stimulation process and how to make it a little bit less nerve-wracking self-injecting or having someone else help you with injections. So first of all, please could you tell us a little bit about IVF injections and what people should expect when they start treatment?
Okay, so when patients start treatment, there's a number of injections they may need to take during their treatment. The time period that they're doing injections for tends to be around about sort of 14 days to 21 days, depending on the protocol that the patient's on. If they're doing treatments such as a frozen cycle or something else like that, they might be doing injections for a little bit longer than that, but it's generally just one injection a day that they will be taking. The injections are quite easy to give. They will be given a number of different things to watch prior to doing their injections, and each drug company will provide other bits of information, and so that the drug companies themselves will provide injection guides which you can take away with you, which you can be given by your clinic to help you go through the process, which will take you through each step of the way. Here at our clinic, we have provided our patients with injection videos that we've put onto one of our portals, so they're able to access that at any time during their treatment. So they're advised to watch those after they've had their first nurse consultation, so they're familiar with what they're going to be doing when they come in and they start their treatment. They then have adequate time to ask the nurse at that first appointment, before starting the medication, what they need to do. If they've seen the videos and they've got any questions, that can be gone through. They can even ask to have a face-to-face where they actually watch the nurse do it in front of them if they're really concerned about doing the injections. Then during the treatment process, if we're adding in injections as we're going along, we'll inform them of that injection, explain when they need to do it, give them reminders, and also once again direct them to watching the video again if they haven't seen that video, to just refresh themselves. We're always at the end of the phone. We're always at the end of an app to ask us questions, so they've got all those things that they can do to help them and assist them with doing their injections. I think the main thing to say is, it's natural to feel apprehensive about doing injections. It's not something that you do to yourself in a normal everyday circumstance, and I think that it's quite often the fear of doing the injection or the anticipation of doing it is often much worse than the actual process. I would say to patients, make sure you're prepared before you do the injections. Don't be rushing that first injection. Make sure that you've got everything set out that you need, that you've familiarised yourself with all the bits and pieces that you're going to be using. You may be somebody that you prefer to do the injections on your own. You might want to take yourself away somewhere that's quiet, that you can sit there and do the injections, purely just yourself with those injections there. You might be somebody that would rather have your partner or a friend there to help you. You might want to be the one that's giving the injections yourself. I mean, we certainly have some patients who start off, they want their partner or a friend to give the injections because they're worried and hesitant about doing the injections, but after the first or second injection, they realise actually that's worse. They'd rather be more in control. There's no right or wrong way, and if you're somebody that needs somebody to give that injection to you, it doesn't mean to say that you're less able to, do this and you're not doing it as well as somebody else that can quite happily do them on their own. It's just how we cope with it ourselves and what makes the experience and the journey easier for you.
And how long will people tend to be having injections for?
So they're having injections for, as I said, for around about 14 days to 21 days. Dependent on the protocol, but the average nowadays we tend to use what we call the antagonist protocol most. So those patients are normally on the injections for around about 14 days.
Great. And I think you've got something with you, haven't you? Can we see you've got some medication with you just to show people what it looks like?
The medications that we use, a lot of them come maybe in cartridges or a pre-filled pen. So you might have some like this where you insert a cartridge and then you turn a dial and do an injection each day using the dial. So this is that pen there. You put the actual drug inside this part here, and then it's a case of just turning around to your indicated dosage that you've been told to take and then doing the injection. Other drugs come similar, different brands come with the drug, once again, already mixed up. And then you may have others where you actually have to reconstitute it. So one of the drugs that we use is a drug called Menopur, which comes with a little white tablet in here, and you'd be given a couple of little syringes with fluid, which you have to put into this little vial to make it into a fluid. And then each day you can then just use a little syringe that's calibrated to take out the amount of drug that you need for that day. Nowadays, majority of the drugs that we're using, you mix up either once and then take a small amount out each day, or they're pre-filled. There are a couple of drugs that you have to mix up each day, but they don't tend to be the ones that we use quite as often as the others. And certainly because there's quite an array of drugs that you can use, the doctors can, if you particularly have a big problem with doing the mixing up, can always find something else that's maybe a bit better and a bit user-friendly for you.
And how many different types of injections would people expect to be taking during that 14 to 21 days? Okay,
so majority of patients will take 2 or 3 injections. Because here at our clinic we tend to use a mixture of some of the FSH injections, so we might use 2 different drugs to stimulate them, and then we're quite often be using one of the drugs to suppress ovulation, so to stop the LH rise. So that might be using something like Supercure, which is already all mixed up and you give with a little syringe like this, or it might be using a drug such as Frimidel, which is actually already in the syringe, all mixed up, and it's just a case of just taking the lid off and doing the injection.
And why are people instructed to do the injections normally in the evening, am I right? Within the window?
Okay, so here we like to do the injections in the evening. It's purely a logistical reason. Within our clinic, we do our scans in the morning, and when we do our scans, we also take blood sometimes to check hormone levels. And then we have a meeting later on in the afternoon when we've got all that data together with one of the consultants. So if we want to change the dosage that that patient's on to get the better result out of their cycle, then we can make that change from that next injection that evening, rather than waiting until the next day. And that's it's important if we're increasing dosage, but it's also important more so if we want to reduce the dosage, because if the patient's already done that injection that day, they've already taken that higher dosage of the drug, which maybe you wanted to reduce at that point.
Absolutely, makes total sense. Now, a common concern people have, Fertility Help Hub and the trying to conceive community, I'm sure patients come to you apprehensive about side effects of injections. What can be side effects, and what are your thoughts to ease those?
Right, so from the injections just themselves, from the actual physical part of doing the injection, main sort of side effects you might get is some redness, bruising around where you've done the injection. It's a good idea when you are doing your injection to make sure that you're inserting the needle. You'll have some patients that are very hesitant at inserting the needle. I would always say to them, make sure you insert the whole of the needle, because they're actually quite small needles. And don't do it at too much of an angle. You really want to be doing it at a 45 to 90 degree angle and going in. And go in with like a smooth, fluid process. You don't have to jab really hard, but go straight in quickly and then draw out slowly. And that will help you to reduce bruising and things like that. If you do get a bruise though, quite often it's not that you've done anything wrong. You might just cause a little capillary and it's caused a little bit of bruising when you've done that injection. Also, just rotate the area that you're doing. If you've noticed it's become inflamed or red in one particular area, don't then go and do the injection in exactly the same area the next day. We tend to tell our patients to do their injections so around about an inch away from the belly button. You can go lower onto the side of the belly button, but I wouldn't go above the belly button. Just do it sort of around there. So that should give you plenty of area to do those injections. There are some clinics and some places that some patients might prefer to do the injection into their thigh as well. So you can do it in the top part of your thigh, and that can give you another area, especially if you're really struggling to find another area where therefore it won't be quite so uncomfortable, and you might not get so much bruising or sort of marks where you've done the injection. So that's kind of what I would say is to try and sort of prevent that. And then I think really, sort of side effects wise, it's quite common when you're going through IVF. We are stimulating your ovaries, so it's quite common to feel a little bit bloated, breast tenderness, and things like that. They are quite common sort of side effects. So if you start feeling those, that's quite normal. I would always say to any patient, so if you're starting to feel side effects and you're concerned or you're worried, the main thing to do is contact your clinic or speak to somebody and just check, is it normal to feel like this? I think, you know, any fertility nurse will say they would rather a patient contact us and say, I've got this, is this normal? And I'll say, yeah, it's completely fine. That's how we expect you to feel, rather than them sitting there for maybe 2 or 3 days between appointments, worrying that something's going wrong, or, you know, I shouldn't be feeling like this.
Definitely, definitely. So these are subcutaneous injections, aren't they, during stimulation? Yeah. And then after egg retrieval, what happens then?
So after egg retrieval, I mean, the majority of our patients here will just be using some pessaries to support themselves, to support their body and support everything afterwards. So after the eggs have been retrieved, they will obviously go home that day. The following day, they will find out their fertilisation results. They'll find out how many of the eggs that we've collected have fertilised, so that they know how many embryos they've got. And then the lab will be their main source of contact over the next few days. Medication-wise, we give our patients predominantly Cyclogest in the second part of their cycle, and Cyclogest is like a little pessary, a little bit like a suppository, which we get them to take twice a day from the day after egg collection. So that's all that they will be taking at that point. We do have a few patients for, you know, alternative reasons that maybe they can't use that, or they need to have a little bit more progesterone, that might use a small injection. Once again, that is also subcutaneous as well, and quite easy to give.
So you don't do intramuscular progesterone?
No, we don't use intramuscular progesterone. And
so for the suppositories, people put them into the vagina. How many times a day?
So initially they will use them rectally, and the reason for that is we've just done the egg collection. It gives time for everything to heal, and also, you know, they can leave quite a lot of residue, and obviously when we're then going to go and do an embryo transfer, we don't really want too much residue to be there, too much cleaning to be needed to be done before we're passing the embryo back. So we would ask them to use them rectally to begin with. If they're doing Cyclogest, they would do that twice a day. And then once they've had their embryos put back, they can then use it vaginally or rectally, whichever they prefer. I mean, Cyclogest is, most patients will probably say it's the worst drug that they have to do out of all of them, believe it or not, compared to the injections. And I think that's just mainly because it can leave a little bit of residue, so it can just be a little bit more troublesome in that respect. You know, that's the one that we tend to use predominantly. There are other types of progesterone that you can use. They don't have to be an injection. So there are things such as Nutrigest, which is like a vaginal pessary. So they would use that 3 times a day vaginally. You know, that works quite well. Or Utrogestan, which is also a similar sort of thing. It's a vaginal pessary as well.
Makes complete sense. Thank you. What about compressors to make things less painful?
So in regards of doing the injections, so in regards to doing the injections, I mean, I would say probably the one thing that most patients might say if they struggle with injections, that they use their little handy hint, which is probably ones that have gone round, etc., are to use ice. So quite a lot of patients might use a bit of ice, and they might just numb the area where they're about to do the injection, so they can do that. I'd also say when you're doing the injection, pinching the skin where you're about to do the injection, that also helps as well. You know, you kind of feel that you're a little bit more in control, because if you're holding your skin as you're doing it, you feel like you're holding on to something as you're putting that needle in. So it makes it also feel like it's not actually going right into you, and you know, so if you can pinch a little bit, then that's always good. And I would say, you know, once you've done your injection, treat yourself, you know, give yourself a bit of chocolate or, you know, something nice. And then it gives you something to look forward to and think, right, if I've done that, then that's my little treat for the evening because I've done my injection.
Absolutely. We've talked about side effects in terms of locally, but what about, what might patients experience in terms of hormone changes and the way that they feel, you know, headaches or...
Yeah, so... Yeah, everybody's different. Some patients may feel a little bit headachy while they're on the treatment, might get a few headaches. You can take some normal sort of paracetamol for that and things like that. You know, feeling bloated as you go through, as your ovaries are looking a little bit large, a few twinges every now and again, maybe a bit of feeling of heaviness. Some patients get a little bit of backache as well. Breast tenderness can be a really common side effect as well. And I mean, I always say to patients, be aware that you might get an increase in vaginal secretions. We do get quite a few patients that, might phone up in a bit of panic, I think I'm ovulating. And it's just as the estrogen level is going up, obviously your body's preparing because it's thinking it's getting near ovulation, because that's normally what happens. So it gets itself ready. And that increase in vaginal secretions is very common leading up to ovulation. So it's normal to get that as well when you're doing treatment. Other things that I would say, being more tired than normal. Really common sort of side effect. And you do get patients come in and say, I was exhausted, I'm going to bed at sort of 8, 9 o'clock in the evening. It's not like me, but just feeling generally more tired than usual is a really common sort of side effect. And then as they go through the cycle and the estrogen levels rise up, everybody's different, but some people are very susceptible to rises and changes in their hormones. So feeling maybe a little bit nauseated every now and again can be representative of that increasing estrogen level. Let your practitioners know, obviously, if you're starting to feel nauseous and things like that, they can keep an eye on those hormone levels. But also be aware that that can just be, a side effect of it. After egg collection, you may still feel bloated for quite a few days, even a couple of weeks afterwards. Your ovaries are still going to be quite enlarged, so that's not uncommon. Keep an eye on things though, any sort of, drastic increases in weight, feeling extremely bloated, feeling nauseous, breathlessness and things like that. They're things when you should be contacting your clinic and discussing, how you're feeling with them. But just generally feeling a little bit more bloated than usual, a bit of wind pain, maybe a little bit constipated. The cyclogest can cause that and can make that worse. So, they are sort of the sort of common things you might feel in that sort of second part of the cycle as well.
Brilliant, thank you. What about the trigger shot or trigger injection? What should people expect for that? And is there any help available at the Agora for people who are approaching that time?
Okay, so the trigger injection has changed a lot over the years, and it's now given in the form of a really easy to use little pen like this. And basically all that you will have to do is already all prepared there. And you also will have obviously some fluid in here, and then all the patient has to do is just attach the needle, turn the dial and do the injection. So they would have been doing injections anyway, and this is no different to any of the other injections they've been doing. So although it's it's like the trigger injection, the big injection, that last one, it's actually it's exactly the same as their other injections they're doing. This is just a one-off dose. So rather than looking at their dial and turning it round to a certain amount of units, they literally just turn the dial right the way to the end, where they'll see the numbers coming up in the little window that they've got there, and then they literally just put the needle in, press the plunger down and do the injection. So it's no different than the other injections.
Is that one intramuscular?
No, it's subcutaneous as well.
Oh, amazing.
Yeah, so they're all done subcutaneously now, which makes it a lot more user-friendly. And as I say, the worry and the fear, it can be just, drawn away from the fact that it's, almost identical to the other injections they've been doing.
And why is there such a pressure on the time that you do the trigger injection?
Yeah, so we need to get there. We need to use this trigger injection to mature the eggs and the follicles and get them ready for the egg collection, but we need to get there before ovulation. So that's why we have the timing. The timing is to be able to go in and collect these eggs when they're going to be at the perfect time for us to collect them prior to the patient ovulating, so that we're then able to use them in the treatment.
Fantastic. Please, could I ask you, how do you support patients at the Agora? What's your role as the lead fertility nurse?
Okay, so how we support patients here is there's a number of different ways that we support our patients. So we, starting off, when they first come through the door, we use the Salve app here. So the Salve app is an app that has been made for fertility clinics, and it has a fantastic user profile to it, in the respect that it allows texting. So our patients are able to text us a message and we can text them back. And we've all been there, we've all done the telephone tennis, where I phoned you to ask a question, you phone me back, you miss me. With this, all the nurses have access to it. In fact, everybody in the clinic has access to the system, and so any patient that sends a message can be answered wherever we are in the clinic. And that's a really good way of supporting patients, because they're not left waiting for a phone call 2 or 3 or 4 hours later. Generally, if it's just a quick question, somebody can get them an answer straight away. And if their question isn't answered straight away, somebody can go off and find the information, but we can keep their message up there so we know that it's still waiting to be dealt with. Then we also have counsellors. So we don't have a counsellor, in-house counsellors, but we have counsellors that we work with. And so we give the patients their details, so they are able to access those counsellors for any extra help they may want. We also run a peer support group, or which we run every 4 to 6 weeks here at the clinic. It's done over Zoom and has been since the beginning of the pandemic. And actually we've decided at the moment we're going to keep it that way, because we found that for patients it's actually a lot more easier for them to access, because they might be at work or they might be rushing to get home, and 6 o'clock in the evening, they might normally have been on a train, but they might be working from home now, so that they can quickly just log on after they finish their day's work, and then they can then, in that meeting, meet with other patients and discuss and share tips of how they're coping with the treatment and what they found is a good way of doing maybe the injections, for instance, or how they felt after egg collection, and whether they've got any, anything to share with the others in the meeting. It normally runs for around about an hour to an hour and a half, really, until the patients have had enough time to discuss things. We also then have a closed Facebook page which we use, and that works in a very similar way, where patients can put up posts and they can discuss things amongst themselves, and we can also put up posts or put up a blog or things like that. And then we have our patient support calls. So every patient that comes through for treatment is offered patient support calls. And that might be for you prior to you coming in for your first appointment. It might be after egg collection, after embryo transfer, just to support you in those couple of weeks while you're waiting for your results, knowing that there is somebody there. Some patients are very hesitant at picking up the phone. So they might say, yeah, I'd like a support call. And it might just be that preemption that we can then call you, and they can then ask any questions they've been thinking but they haven't really wanted to call. So that, we're just conscious that not everybody's situation is the same. Not everybody has the same support group, and support in their family or out further community. And so some patients might need a lot of support. Other patients might say, no, I'm fine. So we leave it up to patients to a point and say, if you want it, it's there for you, and this is what we can offer you, and then go from that. But obviously, if we see a patient that we feel is struggling with it, we might then sort of say, have you thought about trying this, or have you thought about trying that?
Mm-hmm. Fantastic. Thank you so much for your advice today, Victoria. Any last words of wisdom for anyone who might be apprehensive about starting the IVF process?
Just take it one step at a time. You'll come for your nurse consultation, or you'll do it over Zoom, or you'll see the doctor, and it'll feel like so much information is being bombarded on you. And I think what you should just always remember is it's a process that goes one step at a time, and each time you come in, we'll be telling you what the next step is and what you're doing. Or you'll see the doctor, and it'll feel like so much information is being bombarded on you. And I think what you should just always remember is it's a process that goes one step at a time, and each time you come in, we'll be telling you what the next step is and what you're doing. The idea of most of our consultations is to give you an overview. This is what's going to happen. But we're not expecting you to remember everything all the way, and we're just saying to you, just take it one step at a time. Spend time, take a deep breath, relax. When you're going to do your injections, it don't have to be rushed. You can do them slowly. There's nobody saying you've got to do it in 2 minutes. If it takes you half an hour to do that first one, that's fine. But just feel confident in what you're doing and know that you are being supported. And if you've got any questions, always ask.
Fantastic. That's wonderful advice. Thank you so much for your time, Victoria. And for anyone who wants to get in touch with the team at the Agora, we're putting the details here with the link in bio. So thank you so much.
Thank you.